am Michaela Whitman, a dental hygienist with Zygmunt's Dental Group in Middlebury, Vermont, and I am here to talk about alcohol-free mouthwash. I have found many problems in my practice with people who use alcohol-containing mouthwash, and I would like to discuss them with you today. First, we're going to talk about dry mouth, then we're going to talk about burning mouth, and then the possibility that an alcoholic will have a relapse. We will then have a solution, which will be to implement Listerine Zero, which is an alcohol-free mouthwash. Have a project budget, so how much is it going to cost to implement this in 1 year's time? And then we will have a conclusion and question and answer session. First, we will discuss dry mouth. Now, dry mouth is a very serious condition. Patients will come with reduced salivary flow, and their tongues will appear very fissured, as we see in the picture on the left. This patient's tongue is very inflamed and dry, and this is very uncomfortable for patients. But not only that, it can also be a problem in increasing the possibility of caries because of the oral dryness. It's actually due to the fact that the saliva is not clearing the bacteria away from the teeth. That bacteria produces acids which attack the tooth. So when they're allowed to stay attached to the tooth, they're going to cause more of an acid attack than they would if you had saliva taking those bacteria away. There will also be an increased malodor problem, because that bacteria is going to collect in crevices in the tongue or in the oral pharynx, and people are going to breathe out bad breath. So this is one thing that we can eliminate if we cut out this mouthwash containing alcohol and replace it with a mouthwash that doesn't contain alcohol. Next is burning mouth. Now, burning mouth is quite an irritation for patients. Now, they come in and we have them rinse with the mouthwash because we want to reduce the amount of bacteria in the oral cavity. That way we're less likely to contract something from the patient. But then they take that mouthwash and they say, wow, that was painful, or that really burned my mouth, which is very common among people. Most of my patients say that to me. And it can be normal just to have that happen, but it can also be worse when patients have sores in their mouth, because it's going right to that connective tissue and causing that strong sensation, because that's where all the nerves are, the nerve endings. Adverse events, a source I found, said that this was one of the top 3 adverse events that was reported. Next, we have also the risk that an alcoholic will have a relapse. Now, this can occur because, as we all know, our patients sometimes lie to us. They may come in and say, no, I have never had a problem with alcohol, but they have, and they just don't want to tell you about it. And in these cases, we need to be prepared to counteract that, because we don't know which patients are telling the truth and which ones are lying. And in order to do that, we need to be prepared. And in order to do this, we need to replace that mouthwash with one that doesn't contain alcohol, because they may take that mouthwash and then go down that road again of having issues with alcohol. And we don't want to put them into that. We want to eliminate that. Now, The solution is to use Listerine Zero, which, as I said, has no alcohol in it. So there's a decrease in the burning sensation in the mouth, because the main ingredient in most mouthwashes that causes that burning is the alcohol. So with the elimination of it, the patients can have that refreshing feel without having the burning sensation. And also, Listerine Zero is just as effective as regular Listerine that does contain alcohol, because it's not just the alcohol that helps kill the bacteria. It's other things like menthol in the solution that are very good at killing that bacteria. Also, there will be no dry mouth, because it's the alcohol that causes that dry mouth. So if we eliminate it, we're not going to experience that as much. Now, patients may come in with dry mouth, but it won't be due to the mouthwash. It will be due to other factors. And there's no risk of an alcoholic relapse. If there's no alcohol to trigger a relapse, then it's not going to happen because of the alcohol in the mouthwash. Now, as we can see in this picture here, there's no dry mouth. This is a very healthy and there's saliva in this mouth here. We can tell that there's good salivary flow. There's no crevices in the tongue. No, it's not dried out. It's very healthy. So in this case, we're not going to see an increased risk of caries. It's going to be very stable, much lower risk, and this patient is probably not going to have bad breath either. And they're going to feel very happy because their tongue is not sticking to the roof of their mouth, and they smell pleasant to other people. Also, this mouthwash is very cool and refreshing. Patients will want to use this mouthwash. It will cause greater patient compliance in using mouthwash, which is a good thing because mouthwash is used to decrease bacteria in the oral cavity. And if patients are using it regularly, it helps decrease things like gingivitis and other issues in the mouth. So this is a very good thing. Also, it's alcohol free, which is excellent. There's no chance that those patients are going to tell you, "Oh, I have no alcohol problem," and they're not going to go home and have an alcoholic relapse because there's no alcohol in the mouthwash. Also, with the implementation of plastic cups replacing our paper cups that we've been currently using, we are not going to see mouthwash spread out all over the counter because the mouthwash isn't going to leak out of the plastic cups like it leaked out of the paper cups. Now, what it's going to cost to implement this? The mouthwash costs $3,500 for an entire year, which is excellent. And actually, the mouthwash we have been using in the Vermont Technical College Dental Hygiene Clinic has cost about $3,500 per year anyway. So this is not going to change that cost that we have been seeing. Also, we are going to use plastic cups, which cost $500 per year, which is also about the same cost as the paper cups we've been using. So it's like a little swap. And then personnel, which would include the project director, the part-time employee, and the trainer. That will all, in 1 year's time, cost about $50,000. Now, this is just for the initial first year. After the first year, this will probably decrease by half because we won't need the trainer anymore. Our employee will be trained, and all personnel will be trained. So that payment will be cut out, as well as the director will not need quite as many hours worked in. So that will also decrease it as well. And the total is $55,500 for the first year. And of course, it will be decreased the second year, which is a plus. And for conclusion, this mouthwash is alcohol-free. There's a decreased risk of burning in the mouth, which increases patient compliance. No dry mouth, so decrease in bad breath and dental caries. There's no cup leakage, and it's going to be very inexpensive to do. Now, are there any questions?